I'm Dr. Ben Newman, and this is Ask Dr. Ben. I'm a coronavirus researcher, and I will try to answer your questions. All right, so the next question is a long one, and it's on the computer behind me, so let me look over for just a sec. This is from Dan. How you doing, Dan? All right. Let's talk aerosols. Oh, let's talk aerosols. That's fine. Let's go. I'm a little confused about risk factors from floating aerosols and what that would look like in the real world. Yeah, okay. All right, I like this question. What I'm unclear about is the relative risk of infection of aerosols if you encounter them hanging in the air once a person emitted them and physically left that space. That is a multi-million dollar question right there. So the answer is it's hard to be certain. I don't think there's a definite answer to this that I can call up a paper and say exactly this much. And that's very much what everybody would like. Part of the problem there is that you can't do the experiment that would actually give the result that everybody wants. Like everybody wants to know if you get a little bit more virus or a little bit less virus that you inhale that starts the infection, does that make the disease worse or not? Yeah. You can say in animal models, generally, the more virus that goes in, yeah, the worse the outcome. But you can say for people, haven't done the experiment, totally unethical to do the experiment, not going to do the experiment. And so, because of that, the best you can do is say that, well, here's why I think that probably that's a thing. Yeah, and this is the same kind of question. To do this, so you can show that when a person's been in a room, that you can detect virus in aerosols, and you can detect virus that settles onto surfaces later, particularly in bathrooms, in like hospitals that have COVID patients. Yeah, that's where you get relatively high levels of detectable virus. Then the question is it virus that is able to infect? How well does it infect? And yeah, we don't know the real answers to any of those questions because it's not an experiment that you can do, really. I'm trying to think how you could get close. You could make something like a fake version of the virus, but it still has spikes on the outside. And instead of delivering the virus genome, you could try and deliver a little piece of like fluorescent, I don't know, fluorescent protein gene. But even then, it would be a question of, well, how do you tell then how many cells have turned green inside of a person? Because that would be our surrogate for whether a person was infected. And I don't know. You'd have to try and like scrape them off the inner lining of the throat or something, windpipes. It doesn't sound like a pleasant experiment. It doesn't sound like one where the risks to the people being experimented on would be justified by the potential reward in terms of knowledge gained. It just sounds like a non-starter. Yeah, completely, and I'm okay with that. Yeah. But that's kind of why there isn't an answer to your question, which again, very unsatisfying. But let us go on. Okay, the rest of the question. Okay, so I asked this because it seems like if incidental aerosol, like somebody was in the room, cough, 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 and then they walk out, and then you walk in. How long do you have to be there? How much do you have to breathe? We can point to specific cases where people were a certain amount of time. There was one in a Vermont prison where a guard wearing a mask did manage to pick up the virus. There were 3 incarcerated people, I think, there. And they were sometimes wearing masks and sometimes not, but all 3 of them were positive. And so, what was the amount of virus that the guard was exposed to? Can't tell. How much of that virus was actually infectious? Don't know. How many of those particles that were infectious actually managed to land on a receptive cell, get past all the mucus and the cilia and everything else? No idea. Yeah. So it's just a thing that potentially can happen. And so that's how I view it. In a world where this is a thing that definitely can happen, where we have examples where it has happened, I would tend to argue on the side of let's be a little bit overcautious, if anything. So, yeah, if it's a shared indoor space where I think somebody else could have been in there at all, mask or no, then I'm going to definitely want to have a mask in there. I'm only comfortable in my office because it is only me in the office. There's a nice lady that takes out the trash every Tuesday. And so, yeah, I'm not in here when she does that. But other than that, yeah, I think everything else is gambling. And I don't want to gamble with COVID-19. Yeah, it sounds like you might not want to either. Yeah. But just to finish up the last little bits of the questions, so if incidental aerosol exposure is a real concern, it would counter some of the safety from those 6 foot waiting markers. Yeah, like in the supermarket, like in the hallway going into classrooms. Those are like an attempt to try to make it less likely to some degree that virus transmission occurs. There's not a lot of really hard science where this is the thing that definitely happens every time you come within exactly this range and this amount of virus in the air. Yeah, you can have asymptomatic people that have a little virus or maybe even a lot of virus. We just don't know. And all these things are going to be factors that would kind of be missed by any answer. Like there's so much variability already in the problem that any answer other than dunno, it depends, is probably not telling, is not a good answer. Yeah, if that makes sense. Okay, and then last but related question. Has there been any recent research on how long aerosolized SARS-CoV-2 particles can remain in the air indoors? The experiments that I have seen have been with coronavirus and influenza virus, and they looked at transmission both with a mask and without a mask. I've seen the respiratory droplets. They'll usually have people breathe into a box, and then the box is there so that you can shine a laser through it and try to read out the number of particles in a little patch of air that the laser passes through. All of these are imperfect ways to do it. You'd like to know about the entire cloud, but the best you can do with a test, it's really hard to count these little tiny droplets. It takes some sophisticated equipment. You can just measure little bits here and there and then assume that probably that's representative of what the rest of the cloud is. But yeah. And I haven't seen it done with actual virus where you can actually spot the virus as different from the droplet. Because something like a laser is just going to interact with a droplet, and the droplet may or may not have a virus inside, but the droplet's going to be mostly water anyway. And so, yeah, I'm not even sure how you would do that. I can think of a way. I guess you would have to load up the virus with something fluorescent that was just in the virus and wouldn't leak out into the water. And then you could get a picture of where the water droplet is, and then you could switch to like a different fluorescence, and you can see, oh yeah, there's a little bit of a green fluorescent thing inside the water droplet, and so there was probably a virus in there, something like that. Even then, can you prove it's this definite virus and not some other virus? No, not with lasers. Yeah, in any meaningful way that I know of yet. I know there are people trying though. But yeah. So that's probably a very unsatisfying answer to a very long and actually well thought out question. I would. So we still don't know of anybody who has got coronavirus from any method, like definitely got it from any route other than an aerosol. So it looks as though aerosol is probably the only meaningful way that anybody gets infected. And so, with that in mind, I just think minimizing exposure to other people's aerosols is definitely going to be the thing that is most likely to keep you safe from an aerosol transmitted, like aerosol only virus. So there you go. That's why I'm thinking what I'm thinking. But yeah, it's one of those questions where there isn't a definite yes and no kind of answer that people would like. And I think anybody that you hear giving a definite yes and no answer on this is probably doesn't know what they're doing. And yeah, you know, That's okay, but you shouldn't be giving advice if you don't know what you're doing. There you go. All right. Thanks very much. This has been Ask Dr. Ben.